Are you in love or are you falling in love? Now, let me tell you something about premarital testing generally. People tend to wait for that last moment to go and begin having these tests done. Because you know why it doesn't make sense? If you're deciding to do these tests at the time when you found the person, you have already gotten so far, you have created a bond, things are already so intense. By the time you do that and you go to hospital and maybe you find out something you don't want to find out, chances are you're going to say, you know what? Love is love, let's fight through this. And eventually it's your kids who will suffer, or the both of you that will suffer. Now, me, what I normally advise people, when you've met someone, the first date, it's fine, go eat and everything. If you think there's a possibility of a second date, you'll be like, why? Second date, let us start from the hospital and run this test before any other strings begin getting attached, because it begins getting much, much, much harder for you to be able to do. First of all, there's some obvious tests you have to do. You do a CBC just to get a routine check of how are you both doing, check your urine. It shows possibilities of infections that are in there that could be treated before you begin engaging in sexual activity. Hepatitis, HIV, obviously, and then do things like diabetes so that you both know where it is that you are standing. Now, another thing that I want you to always test for is sickle cell. Let me tell you, I have been to about like 3 facilities, no, about 4, let me say across the different parts of the country. And this is what I've noticed in Uganda, in Ugandan hospitals generally. I've been to Fort Portal, Hoima, Jinja, and then within urban Kampala. Within urban Kampala, where I have been, sickle cell isn't very common. In Mulago, however, it has its own ward, yeah? Now, for Jinja, sickle cell disease was very, very high. There was a whole ward separate to that alone. Sickle cell within the population is a very common illness. Hoima as well, the same thing, whereby even patients who had the traits or poor one, just carriers of sickle cell, would have symptoms of things like recurring malaria, yet they're supposed to actually be immune against it. Within Western Uganda, I've seen in Bushenyi, Shaka, sickle cell was not a common thing. It was something you would see maybe like 1 patient or 2 patients really in a month. It was a very rare thing. Now, if your people, especially if you know that you come from these regions, that means that you need to know that there is genetic predisposition of getting this particular disease. Now, when babies have it, oftentimes the most sad thing is that you'll find that they're taken care of by the mothers, because the fathers believe that I cannot have a child who has sickle cell disease. And it is very false, because sickle cell, we call it an autosomal recessive disease. It means it's supposed to have traits from both the mother and the father to be able to combine and get the disease. So you may find that the mother was a carrier, the father was also a carrier, and they did not know, and eventually they have a baby who is a sickler. And babies who have sickle cell disease, you will really have a hard time, because it's hard for you to get out of the hospital. They're in pain all the time. It often causes a stress and strain on the relationship, which if you had known before, perhaps you would have taken a better route. Now, so there's types of hemoglobin. When a baby is still in the mother's abdomen, up to 6 months when they're born, they have a type of hemoglobin called hemoglobin F, which is fetal hemoglobin. This particular one is really good. So we use some drugs like hydroxyurea, which we use to make sure that the patient, we increase their fetal hemoglobin, because this one doesn't sickle, it's not really mutated, it doesn't really carry that particular pain of sickle cell disease, yeah? So the symptoms are much less. Now, when a baby goes beyond 6 months, that's when symptoms begin to show. So they get things like the fingers begin to swell, the boys begin to get erections, which are very, very painful. We call it priapism. Begin having difficulty in breathing, pain in the whole body. Now, these are things that you should look out for. And I'm going to show you how sickle cell happens. So let me illustrate for you. You'll have hemoglobin A. Hemoglobin A, this is a normal person, yeah? Hemoglobin A and S, that means you have one of the adult hemoglobin, and then you have one for the sickle cell. So that means this is a carrier or a person who has the trait of sickle cell. These ones oftentimes don't show symptoms, and they have an immunity against malaria. I've seen some patients where the patients would have the trait, but they would still have bad malaria, which is recurrent, as if they have sickle cell itself. Now, a person, remember this, so this is for sickle cell. This is the hemoglobin, how it's altered. This is for the normal adult, and then this is for the fetus or for the baby when she's inside there. So if this is hemoglobin AA, this is a normal person, this is normal hemoglobin. If this is AS, this is a person who is a sickle cell carrier. You are a carrier, but you don't have the sickle cell, but you carry it. Then hemoglobin SS, this is a person who has the sickle cell disease itself. I'm going to tell you who can marry who in terms of sickle cell. Now, let's go here like this. So if you're someone who has hemoglobin A, you can marry a person who has hemoglobin A. You are good to go. Perfect. Because when they cross, nothing happens. You'll have normal babies. If a person has hemoglobin A and they have S, this is a carrier. You marry someone who is, let me say, normal. This is how it's going to happen. Look. So hemoglobin A and hemoglobin A, these ones will combine. This is a normal baby, right? Because here you've created A and another A. Now, if you have hemoglobin A crosses with another hemoglobin A, this one here, you're going to have a normal baby. Those are the chances, these are possibilities within the pregnancy. Now, if someone has hemoglobin S, this is the sickle cell, if it crosses and catches here, you will create a carrier. If you have hemoglobin A and you come here, you'll also create a carrier. That means here you have the chances of you having a normal versus a carrier, they are 1-to-1. So you can, every 2 out of your babies will be sickle cell carriers, or 2 out of your babies will be normal based on that. This is an assumption that you're having 4 children, but the chances are random. You don't know who will carry, who will not. If you have hemoglobin A and you are a carrier, and you marry another fellow carrier, this is where the problems come. So this is hemoglobin A, hemoglobin S. When A comes and combines with this A, remember your genes have to come in pairs. So if it comes this and this one, good luck, you have had a normal baby. If this A comes and combines with this S, you have created a carrier, okay? If this S comes and combines with this A, you have created another carrier. The problem that comes is when this S combines with this S, and this is when you're going to have the disease. That means that for every carrier, 1 out of 4 of your babies will have the disease. You cannot know, is it the first one, is it the second, is it all of them, and then you eventually begin to struggle. Sometimes you find some people, all the babies that they will have will be sickle cell disease babies, and so that is one thing you need to be aware of. If you're both carriers, just do not take that route if you have both carriers. This can be done in hospital with some tests like electrophoresis of the HB and sickling test. They do some tests and see where it is exactly that you fall. If you are like this, you are normal, and then you marry a sickler. This is actually not bad. So if you're someone who has sickle cell disease itself, get a normal person. Because you see the same way it crosses, it means that all the babies you will have, all of your babies are going to be carriers of the disease. So if you're someone who has sickle cell, it's much, much better that you marry someone who is normal. Now, another, which possibility didn't I talk about? If you're a carrier and you marry a sickle cell person, you already see how the dangers are coming. The chances of you, at best, you will get a carrier, and it's also very small because as you see here, the S's are much more. Okay, so that is something I want you to be aware about. Although also a person who has sickle cell, because it's a blood issue, you have chances of having very bad complications during the pregnancy itself. So just take note of that. Even the pregnancy may not be able to carry, the heart can fail, there's such big complications. Of course, if you're both sickle cell people, if you're both sickle cell, if you marry, just do not have babies. If you have babies, just be aware of the possibilities. This is me telling you about the possibilities of what could happen. No, we are not God. Science is not God. But this is what it is that we have as a fact and the information that we do share with you so that it can help you make better decisions for your families and for you. I hope you have learned about sickle cell disease. The next cursing like this is going to be about blood groups, and then you understand which groups can marry, which ones cannot. Class dismissed.